In today's wilderness first aid class, we'll delve into musculoskeletal injuries, focusing on identifying and treating sprains, strains, and fractures. Our journey begins with an understanding of the human musculoskeletal system. Bones provide structural support, enabling us to stand and move. Muscles facilitate movement. Tendons attach muscles to bone, and ligaments connect bones at joints. We explore how fractures occur when bones are subjected to forces beyond their capacity. Strains arise from overstretched tendons, and sprains result from overstretched ligaments. Sprains and strains are the #1 injury reported by the American Camp Association's 5-year study on illness and injuries in the wilderness. A key sign of these injuries is bruising, alongside pain, swelling, discoloration, and warmth at the injury site. Bruising results from the rupture of blood vessels due to the injury, leading to blood leaking into the surrounding tissues. This not only marks the skin, but also initiates the body healing process, aiming to repair the damaged vessels and reabsorb the leaked blood, which explains the color changes observed in bruises over time. Now, accurately assessing the injury is crucial. Through observation, patient feedback, and palpation, we distinguish between the generalized soreness of strains and sprains and the localized sharp pain of fractures. Treating sprains, strains, and fractures. We use the RICE protocol, which stands for rest, ice, compression, and elevation. And this is a widely recognized first aid treatment methodology aimed at managing acute musculoskeletal injuries. This approach is pivotal in reducing inflammation, alleviating pain, and facilitating the healing process. And here's an expanded look at the pathophysiology behind the ice, compression, and elevation components of the RICE protocol and how they contribute to reducing inflammation and improving healing. Ice. Applying ice to an injury induces vasoconstriction, the narrowing of blood vessels, which decreases blood flow to the affected area. This reduction in blood flow helps limit swelling, edema, and bruising, thereby minimizing tissue damage. Cold exposure also reduces the speed at which nerve signals are conducted, effectively numbing the area and providing pain relief. The decrease in local temperature reduces metabolic activity, slowing down the release of inflammatory mediators and thereby mitigating inflammation. However, it is important to use ice appropriately, as excessive cold can cause further tissue damage. Typically, ice should be applied for short periods, around 20 minutes, with breaks to prevent frostbite or skin damage. Now let's talk about compression. Applying gentle pressure through compression wraps or bandages helps to reduce swelling by physically preventing the accumulation of fluid in the tissue surrounding the injury. Now, compression supports the veins and lymphatic vessels in removing fluids that have leaked out of the bloodstream into the spaces around the tissue. By keeping the swelling down, compression not only helps to reduce pain, but it also prevents further damage caused by excessive edema, which can increase pressure on the injury site and disrupt the healing process. Proper compression should be snug, but not so tight to cut off circulation. Let's talk about compression techniques. For a wrist sprain or strain, we're going to use elastic bandages. The most common method for providing compression is through using elastic bandages, such as an ACE bandage. Start wrapping at the base of the fingers, moving toward the elbow, ensuring each wrap overlaps the previous one by at least a half a width of the bandage. Keep the wrap snug, but not so tight that it cuts off circulation. The fingers should remain pink and warm, indicating good blood flow. Compression techniques for an ankle sprain or strain include the use of elastic bandages like we use for the wrist. Start wrapping from the base of the toes, moving up toward the lower leg, Ensure you cover the entire foot and ankle, creating a figure 8 pattern around the ankle for added stability. The bandage should be snug to provide support and reduce swelling without impeding circulation. If the patient is wearing high-top boots, you can elect to have the patient put their boot on and lace it up tightly to provide compression around the ankle and the foot. Elevation. Elevating the injured limb above the level of the heart decreases the hydrostatic pressure in the blood vessels at the injury site, facilitating venous and lymphatic drainage away from the inflamed area. This helps to reduce swelling, decrease pain, and improve the overall healing environment. Elevation works with gravity to assist in the removal of excess fluids that have accumulated around the injury site, further preventing or reducing edema. By minimizing swelling and the pressure it places on the surrounding tissues, elevation also contributes to maintaining optimal blood flow, which is crucial for delivering nutrients and oxygen that support the healing process. Together, the ice, compression, and elevation components of the RICE protocol synergistically work to minimize the initial inflammatory response following an injury. This is crucial. While inflammation is a natural and necessary part of the healing process, excessive inflammation can lead to further tissue damage, prolonged pain, and a slower recovery. By addressing inflammation effectively, the RICE protocol helps create a more conducive environment for the body's repair mechanism, thereby enhancing the healing process and facilitating a quicker return to function. Now let's discuss the role of splinting in fracture treatment. Immobilization. A splint provides external support and immobilization, which is crucial for the initial phase of healing. By keeping the fractured ends of the bone in proper alignment, it prevents the fracture from displacing or the edges from moving against each other, which can cause further injury to the surrounding tissues and delay healing. Immobilization of the fractured site reduces mechanical stress and movement, significantly alleviating pain. This is partly because movement at the fractured site can stimulate pain receptors in the outer layer of the bone and surrounding tissues. By limiting movement, a splint also helps to reduce inflammation and swelling around the injury site. This is important because excessive swelling can increase pressure in the surrounding tissues, a condition known as compartment syndrome, potentially leading to further damage. The immobilization provided by a splint creates a stable environment that facilitates the various stages of bone healing. It allows the body to proceed through the inflammatory phase, callus formation, and remodeling phase more effectively without the interruption or complication that repeated movement could cause. Splinting helps to protect the injured limb from external forces that could disrupt the healing process or cause additional injury. This is especially important in the early stages of healing when the bone is still vulnerable. In the wilderness environment, our main reason we splint fractures is to increase patient comfort by reducing pain, reduce swelling and inflammation, and the prevention of further injury by protecting the fractured extremity. A patient presenting with a bone fracture requires immediate, rapid evacuation to professional medical care. In conclusion, the use of a splint in treating extremity fractures is a fundamental aspect of the initial management. It not only supports the body's natural healing process by providing stability and protection, but also contributes significantly to pain management and the prevention of complications. Proper splinting, tailored to the specific type of location of the fracture, is essential for optimum recovery.